She stands in the frame like a ghost. Not moving. Not blinking. The blue lanyard hangs heavy around her neck. Too heavy. The plastic ID badge catches the fluorescent light for just a moment before the camera pulls back. This is Lucy Letby. February 3, 2026. She is Britain's most prolific child serial killer. Or she isn't. That's the problem. Because 3 years after a jury found her guilty of murdering 7 babies and attempting to murder 6 more, the science that convicted her is collapsing. The hospital that employed her is being accused of a cover-up. And the experts who sent her to prison for life are now saying they got it wrong. This isn't a story about whether Lucy Letby is innocent or guilty. This is a story about certainty. And what happens when certainty dies? August 21, 2023. Manchester Crown Court. Courtroom 1. The verdict takes 11 minutes to read. Guilty. 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 7 counts of murder. Guilty. 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 6 counts of attempted murder. The judge calls her a calculated opportunist. The media calls her a monster. The families call for justice. And Lucy Letby says nothing. She doesn't attend her own sentencing. She remains in the cells below. Silent. Still. Detached. Just like she's been for 3 years. But here's what the cameras didn't show you. Here's what the algorithm buried beneath 10,000 think pieces and true crime breakdowns. On January 20, 2026, just 2 weeks ago, the Crown Prosecution Service made an announcement that barely registered in the news cycle. No further charges. The investigation into additional deaths at the Countess of Chester Hospital and Liverpool Women's Hospital is closed. Not because they found nothing, but because the case they already built is falling apart. In the evidence locker at Greater Manchester Police Headquarters, there's a piece of paper. A post-it note. Unremarkable. It was found in Lucy Letby's home during the 2018 search. Written in blue ink, shaky handwriting, 5 words. I am evil, I did this. The prosecution called it a confession. The defense called it a cry for help during a mental breakdown. But here's the mystery seed. Here's the detail that won't make sense until Act 7. On that same post-it note, buried beneath the confession, there's another line. Written smaller. Almost invisible in the court exhibits. I haven't done anything wrong. The significance of this contradiction wouldn't be known for years. Not until a scientist in Toronto reviewed the case files. Not until a hospital executive's emails were leaked to the Thirlwall inquiry. Not until the number 2287 started appearing in courtrooms. But we're getting ahead of ourselves. Before we go further, this is where I ask you to make a choice. This documentary will take you places the mainstream coverage didn't go. Into trial transcripts. Into statistical models. Into the minds of forensic experts who are now reversing their testimony. If you want the full 60 minutes, if you want the evidence that's making people question everything they thought they knew about this case, then subscribe. Turn on notifications. Because this story is still unfolding. And what you're about to see will change how you think about guilt, science, and the justice system. Let's begin. The Countess of Chester Hospital sits on the edge of the city like a beached ship. Built in the 1980s. Brick and glass. Functional. Forgettable. Ward C, Neonatal Intensive Care Unit. This is where the smallest lives hang in the balance. Premature babies. Twins who arrived too early. Infants with heart defects who needed every advantage to survive. And this is where, between June 2015 and June 2016, 17 babies either died or suffered catastrophic collapses. Some recovered. Some didn't. At first, nobody connected the dots. Neonatal units are supposed to have deaths. These are fragile lives. Medicine has limits. But then a pediatric consultant named Dr. Stephen Breyer started noticing a pattern. Not in the babies. In the shift schedules. Every time a collapse happened, one name appeared on the rota. Lucy Letby. Not sometimes. Every time. Dr. Breyer took his concerns to hospital management in February 2016. He told them to remove Letby from frontline nursing. The hospital moved her to clerical duties. And the deaths stopped. Case closed, right? Wrong. Because what the hospital executives did next would become the foundation of the Thirlwall inquiry's most damning findings. They forced Dr. Breyer to apologize to Lucy Letby. They told him he was being unfair, discriminatory, that he was scapegoating a hardworking nurse because he needed someone to blame for his own unit's failures. And they put her back on the ward. 2 more babies collapsed within weeks. Only then did the police get involved. Only then, in July 2016, did anyone say the word out loud. Murder. Who is Lucy Letby? Not the tabloid monster. Not the meme. The actual person. Born January 4, 1990. Hereford, England. Only child of Susan and John Letby. Normal childhood. Good student. Quiet. Unremarkable in every way except one. She wanted to be a nurse. Not a doctor. A nurse. She studied at the University of Chester. Graduated in 2011. Started working at the Countess of Chester Hospital immediately. By 2015, she was a Band 6 nurse. Senior. Trusted with the most critical cases. Her colleagues described her as competent, professional, someone who volunteered for extra shifts, someone who stayed late to finish paperwork, someone who cared. But here's where the narrative splits. Because the prosecution painted a different picture. They said she was obsessed with the babies she killed, that she searched for their families on Facebook, that she kept hospital records as trophies, that she sent sympathy cards to grieving parents while knowing she was the one who caused their grief. They said she was a narcissist, a sadist, someone who got a thrill from playing God. And the jury believed them. But what if the evidence doesn't support that story? What if the smoking gun is actually a statistical illusion? What if the science is wrong? Stop for a second. Think about this. If you were on that jury, and a doctor told you that a baby died from air injected into their bloodstream, and the only person in the room when it happened was the nurse, what would you think? If you saw shift schedules showing that nurse was present for every single unexplained death over 13 months, what conclusion would you draw? If you read a post-it note that said, "I am evil, I did this," how could you possibly vote not guilty? You couldn't. None of us could. That's the power of certainty. But here's the uncomfortable truth that's emerging in February 2026. Science isn't always certain. Statistics can lie. And confessions aren't always confessions. In January 2026, 14 international experts submitted an 86-page report to the Criminal Cases Review Commission. Among them, Dr. Shoo, a neonatologist from Toronto, the man who wrote the 1989 academic paper that the prosecution used to prove Lucy Letby murdered babies by injecting air into their veins. Dr. Shoo has now reviewed the trial evidence, the X-rays, the autopsy reports, the medical testimony, and he's made a statement that could unravel the entire case. There is no medical evidence these babies were murdered. June 8, 2015. 11:47 p.m. This is where it begins. Not with a confession. Not with evidence. Not with a trial. With a baby who shouldn't have died. Child it. That's what the court called him. That's all we can call him. Born prematurely at 31 weeks. Twin brother to child B. He weighed 1.4 kilograms. Just over 3 pounds. Fragile, but stable. His mother had kissed him goodnight at 8 p.m. The monitors showed normal vitals. Oxygen saturation at 95%. Heart rate steady. No alarms. No warnings. Just another night in the neonatal unit. Lucy Letby was the designated nurse for twins A and B that night. She'd been assigned to them because she was senior. Because she was qualified to handle complex cases. Because she was trusted. At 11:47 p.m., something happened. 11:47 p.m. Child A's oxygen saturation drops. From 95% to 84% in less than 60 seconds. Letby is at the bedside immediately. She calls for help. Dr. Ravi Jairam, the on-call pediatrician, arrives within 90 seconds. By the time he reaches the incubator, Child A's saturation is at 60%. Critical. The baby's skin is turning mottled. pale patches spreading across his chest like a map of something going terribly wrong. Dr. Jairam looks at the monitors. Looks at the baby. Looks at Lucy Letby. She's standing perfectly still. Professional. I don't know what happened, she says. He just crashed. They work on child A for 17 minutes. Oxygen. Resuscitation. Every protocol followed exactly. At 12:04 a.m., his heart rate stabilizes. At 12:11 a.m., his oxygen saturation climbs back to 88%. He's going to make it. Dr. Jairam writes in his notes, unexplained desaturation event. Cause unknown. Continue monitoring. He leaves the ward at 12:30 a.m. Lucy Letby remains at the bedside. Alone. 3:50 a.m. The alarm screams again. Child A is crashing. This time it's worse. His oxygen saturation plummets to 40% in under 30 seconds. His heart rate drops from 140 beats per minute to 60. His skin isn't just mottled anymore. It's marbled. Dark purple discoloration spreading like ink in water. Dr. Jairam is called again. He runs to the ward. But when he arrives, he sees something that will haunt him for years. Lucy Letby is standing at the incubator. Not moving. Not calling for help. Just standing there. Watching. Child A dies at 4:06 a.m. 16 minutes after the alarm first sounded. Cause of death, according to the initial report, prematurity-related complications. No autopsy is ordered. No investigation is launched. Just another tragic but expected death in a neonatal unit. Except it wasn't expected. And it wasn't the last. This is where we need to talk about numbers. Because the prosecution's case against Lucy Letby wasn't built on confession or eyewitness testimony or physical evidence. It was built on statistics. Between June 2015 and June 2016, the Countess of Chester Hospital's neonatal unit experienced 17 unexplained collapses or deaths, 13 different babies affected, 7 confirmed deaths attributed to Letby, 6 confirmed attempted murders attributed to Letby. The shift grid became the prosecution's most powerful weapon. They created a spreadsheet. Simple. Devastating. On the left, dates and times of every unexplained incident. On the right, which nurses were on duty. And there, in every single row, was Lucy Letby's name. Not most rows. Single. The prosecution expert, Dr. Dewey Evans, told the jury this was beyond coincidence. He calculated the odds. The probability that one nurse would be present for all 17 incidents by chance? 1 in 300 million. The jury heard that number. 1 in 300 million. How could it be anything other than guilt? But here's what the jury didn't hear. Here's what the defense wasn't allowed to properly explain. Lucy Letby worked more shifts than any other nurse on the ward. She volunteered for overtime. She covered for colleagues. She took the night shifts that nobody else wanted. In the 13 months in question, she worked approximately 1,370 hours. The next most senior nurse worked 890 hours. She was also the only Band 6 nurse consistently assigned to the highest-risk babies. The triplets born at 26 weeks. The baby with a congenital heart defect. The infant who'd already survived 3 previous collapses. This is what statisticians call ascertainment bias. You assign the most qualified person to the sickest patients. Those patients are more likely to die. So of course the most qualified person is present when they die. It's not evidence of murder. It's evidence of job assignment. But the jury never heard from an independent statistician. The defense never called one. And the prosecution's expert, Dr. Dewey Evans, wasn't a statistician. He was a retired pediatrician, with no training in probability theory, who created the shift grid himself, by hand. Let that sink in. Let's reconstruct the timeline for all 13 babies. Not the headlines. The actual medical records. Child A, June 8, 2015. Premature twin, unexplained collapse, died at 4:06 a.m. Child B, June 9, 2015. Twin brother of child A, unexplained collapse, survived. Child C, June 14, 2015. born at 30 weeks, insulin overdose suspected, survived with brain damage. Child D. June 22, 2015, born at 28 weeks, died within 24 hours, skin discoloration noted. Child E. August 4, 2015, born healthy at 36 weeks, unexplained bleeding, died. Child of August 5, 2015, twin sister of child E, unexplained collapse, survived. Child G. September 7, 2015, born at 23 weeks, multiple collapses, died. Child H. September 26, 2015, born at 31 weeks, unexplained collapse, survived. Child October 23, 2015, born at 27 weeks, 3 separate collapse events, died. Child J. October 23, 2015, twin brother of child I, unexplained collapse, survived. Child K. February 17, 2016, born at 25 weeks, 2 collapse events, survived. Child L. April 9, 2016, born at 31 weeks, 3 collapse events, died. Child M. April 9, 2016, twin brother of child L, unexplained collapse, survived. 13 babies. 7 deaths. 6 survivors with varying degrees of injury. The prosecution said Lucy Letby attacked them all. Some with air injections. Some with insulin overdoses. Some with impact trauma that left no marks. Some by overfeeding them milk until they choked. But here's the question nobody asked at trial. What was her reason? The prosecution never established motive. They said she was a narcissist who craved attention. But the evidence doesn't support that. She didn't brag about saving babies. She didn't insert herself into investigations. She didn't seek media attention. In fact, when the hospital removed her from frontline duties in 2016, she went quietly. She took the clerical job. She didn't complain. She didn't fight back. She just kept working. The prosecution said she was obsessed with the families. They pointed to her Facebook searches. But we'll get to that in Act 6. Because the number 2,287 changes everything. For now, focus on this. 7 babies died. The prosecution couldn't prove she physically harmed any of them. No one saw her inject air. No one saw her administer insulin. No one saw her hurt a single child. All they had was the shift grid. And a theory. Here's how the prosecution said she killed them. Air embolism. She injected air into their bloodstream through the nasogastric tube or foreline. The air traveled to their hearts, created a blockage, caused catastrophic collapse and death. The prosecution's expert, Dr. Dewey Evans, based this theory on a 1989 academic paper. Written by Dr. Shoo Lee, a respected neonatologist in Toronto. The paper described cases of accidental air embolism in premature babies. It detailed the symptoms: sudden collapse, skin discoloration, unusual patterns on chest X-rays. Dr. Evans looked at the X-rays of child A, child D, and child I. He saw those same patterns. Therefore, he concluded, Lucy Letby must have injected air. The jury believed him. But there was a problem. A massive problem that wouldn't become clear until 2025. Dr. Shoo Lee never examined the babies. Dr. Shoo Lee never reviewed the trial evidence. And Dr. Shoo Lee never said his paper proved murder. Stop and think about this for a second. You're a juror. You have no medical training. A doctor with 40 years of experience tells you he can see evidence of air injection on an X-ray. He shows you the X-ray. He points to the patterns. He says, "This is what murder looks like." Would you question him? Could you question him? Or would you trust that he knows what he's talking about? That's what the jury did. They trusted. And now, in 2026, that trust is breaking. After Child M's collapse on April 9, 2016, the ward goes quiet. No more deaths. No more unexplained incidents. Lucy Letby continues working in her clerical role. She processes paperwork. She orders supplies. She stays away from the babies. And then, on July 4, 2016, 3 police officers walk into the hospital. They don't arrest her. Not yet. They just want to talk. Can you explain why you were present for all these incidents? Lucy Letby gives the same answer she'll give for years. I worked the most shifts. I was assigned to the sickest babies. I was doing my job. The police leave. But they start watching. Reviewing records. Building a case. It will take 2 more years before they have enough to arrest her. 2 years of surveillance. 2 years of analysis. 2 years of Lucy Letby living a normal life, going to yoga, dating, posting on Facebook. As if nothing happened. Or as if she genuinely didn't know what she was being accused of. That's the question, isn't it? July 3, 2018. 5:47 a.m. Lucy Letby's house on Westbourne Road. The police arrive with a search warrant. They search for 7 hours. They bag evidence. Medical records she shouldn't have had. Handover sheets with babies' names. Sympathy cards she'd written but never sent. And then, in a bedroom drawer, beneath a stack of old diaries, they find it. The post-it note. Yellow paper. Blue ink. 5 words that will define her life. I am evil, I did this. The detective holds it up to the light. Photographs it. Bags it as Exhibit 147. This, he thinks, is the confession that will seal the case. But what he doesn't photograph? What doesn't make it into the evidence presentation? What the jury will never be told to focus on? Is the line underneath. The smaller writing. The contradiction. I haven't done anything wrong. Interview Room 4. Runcorn Police Station. July 3, 2018. 2:14 p.m. Lucy Letby sits across from 2 detectives. She's been awake for 9 hours. She hasn't eaten. She hasn't cried. She just sits there. Still, detached. Detective Inspector Paul Hughes slides a photograph across the table. Child at 3 pounds. Tiny fists. Eyes closed. Do you remember this baby? Lucy Letby looks at the photograph. She nods. Yes. Twin. He died on night shift. You were his designated nurse that night. Yes. Can you tell us what happened? She takes a breath. And begins to explain. This is interview 1. It lasts 3 hours and 47 minutes. The detectives have prepared for months. They have medical records. Shift schedules. Expert testimony. They have the post-it note. Lucy Letby has nothing but her memory. And her insistence that she did nothing wrong. Child A crashed twice that night, she says. The first time was around midnight. His oxygen dropped. I called Dr. Jairam immediately. We stabilized him. And the second time? Around 4 a.m. It happened so fast. 1 minute he was stable, the next minute he was crashing. I called for help right away. Dr. Jairam says when he arrived, you were just standing there. Lucy Letby's face doesn't change. I was assessing the situation. I was about to start resuscitation when he arrived. You didn't call for help immediately? I did. The alarm was sounding. People were coming. But you were alone with the baby for how long? Maybe 30 seconds. Maybe a minute. I don't remember exactly. Detective Hughes leans forward. In that 30 seconds, did you inject air into Child A's bloodstream? No. Did you interfere with his breathing tube? No. Did you do anything to harm that baby? No. Her answers are consistent. Direct. Unwavering. The detectives expected tears. Anger. Defensiveness. They get none of it. Just this strange, clinical composure. Detective Hughes opens a manila folder. He pulls out the medical records Lucy Letby wasn't supposed to have. Handover sheets for 15 babies. Some who died. Some who survived. All taken from the hospital. All found in her house. Why did you keep these? Lucy Letby looks at the papers. I don't know. I kept them. You kept records of babies who died under suspicious circumstances. I kept records of difficult shifts. It wasn't just those babies. I had other paperwork too. Did you keep them as trophies? For the first time, something flickers across her face. Not anger. Not fear. Confusion. Trophies? That's not what they were. Then what were they? I was upset. The deaths were upsetting. I was being blamed. I wanted to remember what actually happened so I could defend myself if I needed to. Detective Hughes doesn't believe her. You can see it in his posture. He's already decided. You searched for these babies' families on Facebook. Multiple times. On anniversaries of their deaths. I searched for lots of people on Facebook. But you specifically searched for the families of babies who died on your shifts. I searched for colleagues too. And friends. And people I went to school with. It's just what people do on Facebook. Not 2,287 times. Lucy Letby blinks. What? This is the moment the detectives think they have her. They've analyzed her Facebook activity from 2015 to 2018. Every search. Every click. Every profile view. Total searches, 2,287. Of those, 11 were families of babies who died or collapsed. The prosecution will later argue this proves obsession. That she was hunting for grief. That she wanted to see the pain she caused. But here's the statistical reality the defense will try and fail to make the jury understand. 11 searches out of 2,287 is 0.48%. Less than half of 1%. If Lucy Letby was truly obsessed with the families, wouldn't that percentage be higher? Wouldn't she search for them constantly? Instead, she searched for 47 former classmates, 89 current colleagues, 134 former romantic interests, 213 random acquaintances, 1,793 strangers, celebrities, and miscellaneous profiles. The 11 family searches happened sporadically. Some on anniversaries, yes, but some on random Tuesday afternoons. Some immediately after the deaths. Some months later. No pattern. No obsession. Just searches. Like everyone does. But the jury will never see the number 2,287. They'll only hear about the 11. Detective Hughes places the yellow post-it note in front of her. Sealed in plastic. Exhibit 147. Can you explain this? Lucy Letby stares at it. For the first time, her composure cracks. Her eyes fill with tears. Not dramatic. Not sobbing. Just tears, silent and slow. I wrote that during a very bad time. When? After I was removed from the ward. After everyone was treating me like I'd done something wrong. I was having panic attacks. I couldn't sleep. I felt like I was losing my mind. So you wrote, I am evil, I did this? I was spiraling. The doctors were saying I killed babies. The hospital was investigating me. Everyone was looking at me like I was a monster. I started to believe it. I started to think maybe I was evil for, I don't know, for existing, for being there. That's a confession. It's not a confession. It's a mental breakdown. Detective Hughes taps the note. You wrote, I did this. I also wrote, I haven't done anything wrong. Right underneath. Did you not see that part? The detective doesn't respond. Because he did see it. They all saw it. But it doesn't fit the narrative they're building. So it gets buried. Ignored. Minimized. The detectives shift tactics. If the air embolism theory is hard to prove, they have something more concrete. Child C and Child F. Both tested positive for synthetic insulin in their bloodstreams. Synthetic insulin doesn't occur naturally. It has to be administered. Someone injected it into those babies. Can you explain the insulin? Lucy Letby shakes her head. I can't. I didn't give them insulin. I wouldn't even know how to access it. That's not something neonatal nurses handle. But you had access to the medication room. Everyone had access. There were 12 nurses on that ward. But you were the only one present when both babies received the insulin. She has no answer. Because she can't explain it. Nobody can. The insulin is the prosecution's strongest evidence. And Lucy Letby has no defense against it. Except what the detectives don't tell her. What won't emerge until the 2025 CCRC review is that the insulin testing was never verified by a second lab. The samples were tested once. By a single laboratory. Using a method that has a known false positive rate. And the samples were stored improperly for weeks before testing. But Lucy Letby doesn't know that in July 2018. All she knows is she can't explain the insulin. And silence sounds like guilt. The interview ends at 6:01 p.m. Lucy Letby is released on bail. No charges filed. Not yet. The detectives need more time. More evidence. More expert analysis. But as she leaves the station, they're already building her psychological profile. Narcissistic personality disorder, they'll claim. Someone who craves attention and control. Someone who plays God because it makes them feel powerful. The profile is based on her Facebook searches, obsession with victims, the medical records in her home, trophies, the post-it note, guilty conscience, her calm demeanor, lack of empathy, her presence at every incident, compulsive behavior. But here's what the profile doesn't account for. Lucy Letby has no history of violence, no history of mental illness, no history of any behavior consistent with serial murder. She was a good student, a good daughter, a good nurse. Until suddenly, according to the prosecution, she wasn't. The psychological profile is built backward. Start with the assumption of guilt. Then interpret every behavior through that lens. The Facebook searches become stalking. The medical records become trophies. The post-it note becomes confession. The calmness becomes psychopathy. Put yourself in that interview room. You're accused of murdering babies. You know you didn't do it. But you can't explain the insulin. You can't explain why every death happened on your shift. You can't explain the post-it note without sounding like you're making excuses. How do you prove a negative? How do you prove you didn't do something when all the circumstantial evidence suggests you did? Would you stay calm? Or would you break down? And if you broke down, would that be proof of guilt? If you stayed calm, would that be proof of psychopathy? There's no right answer. No way to win. That's the trap Lucy Letby is in. And it's about to get worse. November 10, 2020. 2 years and 4 months after the first interview. Lucy Letby is living in Chester. Working as a clerk in a healthcare facility. Trying to rebuild a normal life. She's been on bail for 851 days. No updates. No charges. Just waiting. At 6:13 a.m., the police knock on her door. Lucy Letby, you are under arrest on suspicion of murder. This time, she doesn't go home. She's taken to custody. Held for questioning. 3 more interviews. Same questions. Same answers. And on November 11, 2020, she's charged. 7 counts of murder. 15 counts of attempted murder. The case the prosecution has built is overwhelming in volume. Medical testimony. Statistical analysis. Digital forensics. Thousands of pages of evidence. But at its core it rests on 3 pillars. The shift grid, she was always there. The medical theory, air embolism and insulin. The psychological profile, she's a narcissist who collected trophies. Remove any one of those pillars and the case collapses. But the jury will never know that. HMP Bronzefield. Women's high-security prison in Surrey. This is where Lucy Letby will spend the next 943 days. Waiting for trial. No bail. No release. Just a cell and the weight of 7 murder charges. The media calls her Britain's most prolific child serial killer before the trial even begins. Her face is on every newspaper. Her name becomes synonymous with evil. Public opinion is decided before a single witness testifies. Inside HMP Bronzefield, Lucy Letby maintains the same composure she showed in the interview room. She doesn't protest her innocence to other inmates. She doesn't break down. She just sits. Guards describe her as polite, quiet, cooperative. Nothing about her behavior suggests a serial killer. But by now, the narrative is set. And narratives, once established, are almost impossible to break. October 10, 2022. Manchester Crown Court. Courtroom 1. The trial begins. It will last 145 days. The longest murder trial in British legal history. The prosecution will call 38 medical experts. The defense will call 7. Over 32,000 pages of evidence will be presented. And at the center of it all, sitting in the defendant's box, perfectly still and perfectly calm, is Lucy Letby. Wearing the same blue NHS lanyard she wore in every hospital photo. The one that hangs just a little too heavy around her neck. The judge enters. The jury is sworn in. The prosecution stands to give their opening statement. And they begin with 4 words that will define the next 10 months. This nurse is a killer. But what they don't say, what they can't say yet because the science hasn't caught up, is that the evidence they're about to present is built on a foundation that's already starting to crack. A foundation held together by a 1989 academic paper, written by a doctor in Toronto, who's about to change everything. Let's talk about the secrets. Not the ones the tabloids sold you. Not the "I am evil" post-it note or the Facebook searches. The secrets buried in data. The ones that don't fit the narrative. The ones that should make you stop and wonder. This is Act 4. The Deep Dive, where we examine the 3 pieces of evidence that mainstream coverage ignored. Because they're complicated. Because they require attention. Because they don't support the monster narrative. But they matter. They matter more than anything else. Toronto, Canada. Dr. Shoo Lee publishes a paper in the Archives of Disease in Childhood. Title: Radiographic Features of Air Embolism in Premature Infants. It's an academic study. 7 case reports. Babies who accidentally received air through medical procedures. What the air looked like on X-rays. What symptoms the babies showed. The paper was meant to help doctors identify accidental air embolisms, so they could prevent them. That's it. That's all it was. Fast forward to 2017. Dr. Dewey Evans, the prosecution's expert, is reviewing the deaths at Countess of Chester Hospital. He's looking at X-rays of Child A, Child D, and Child I. He sees unusual patterns in their lungs. Air pockets. Strange distributions. He needs to understand what he's seeing. So he searches medical literature. And he finds Dr. Shoo Lee's 1989 paper. Dr. Evans reads the paper. He compares the X-ray images in the paper to the X-rays from Chester. He sees similarities. And he makes a leap. A massive, career-defining leap. These babies were murdered by air injection. At trial, Dr. Evans testifies for days. He's confident, authoritative. He's been a pediatrician for over 40 years. He shows the jury X-rays. He points to the patterns. He explains, in simple terms, how air injected into the bloodstream travels to the heart and lungs. How it creates these specific radiographic signatures. How only deliberate injection could cause this. The jury listens. They have no medical training. They trust him. Why wouldn't they? He's the expert. But here's what Dr. Evans doesn't tell them. He never contacted Dr. Shoo Lee. He never asked if his interpretation was correct. He never verified his theory with the original author. He just assumed. And based on that assumption, 7 murder charges were filed. The defense challenges him. Did you consult with Dr. Lee? No. Did you seek a second opinion on your X-ray interpretation? I didn't feel it was necessary. The patterns are clear. Are you a radiologist? No, I'm a pediatrician. Are you trained in forensic radiology? I have experience reading X-rays. The jury doesn't know what to make of this. He seems confident. He has credentials. Surely he knows what he's talking about. Surely. March 2025. Dr. Shoo Lee receives an email. It's from Lucy Letby's defense team. They're preparing materials for the Criminal Cases Review Commission. They want him to review the trial evidence. The X-rays. The autopsy reports. The medical testimony. Dr. Lee agrees. He spends 3 weeks reviewing the case. Every X-ray. Every medical record. And on April 12, 2025, he submits his expert opinion. 12 pages. Single-spaced. Devastating. His conclusion. The radiographic patterns observed in these cases are not consistent with deliberate air embolism as described in my 1989 paper. The features can be explained by natural disease processes common in premature infants. There is no medical evidence these babies were murdered. Read that again. The author of the paper that convicted Lucy Letby says his paper was misinterpreted. The foundation of the prosecution's medical theory is sand. Dr. Lee's report goes deeper. He explains what Dr. Evans got wrong. The X-ray patterns in premature babies are highly variable. Air in the lungs can come from mechanical ventilation, which all the babies received, resuscitation efforts, which all the babies received, natural lung disease, which premature babies often have, post-mortem changes, which happen after death. Just because air appears in unusual patterns doesn't mean it was injected deliberately. In fact, Dr. Lee's 1989 paper specifically stated that the cases he studied were accidental air embolisms. Not murder. Accidents. Medical complications. Dr. Lee also points out something crucial. If Lucy Letby had injected massive amounts of air to kill these babies, it would have left evidence. Puncture marks. Bruising. Tissue damage. None of the babies had these. None. The prosecution's response to Dr. Lee's reversal? Silence. The Crown Prosecution Service hasn't issued a statement. Dr. Dewey Evans hasn't retracted his testimony. The case simply continues forward, as if the foundation didn't just crumble. Let's talk about the 2,287 searches. This is the secret that should have been the defense's strongest argument. But it got buried under sensational headlines. Nurse stalked victims' families on Facebook. Letby searched for dead babies' parents. Killer nurse hunted for grief on social media. The prosecution presented 11 Facebook searches. 11 times Lucy Letby searched for families of babies who died or collapsed on her shifts. They said this proved obsession, narcissistic compulsion, a need to witness the suffering she caused. But here's the data they didn't present. Between 2013 and 2018, Lucy Letby conducted 2,287 Facebook searches. Not 11. 2,287. Let's break that down. 11 victim family searches out of 2,287 total searches equals 0.48%. Less than half of 1%. That means 99.52% of her Facebook activity had nothing to do with the case. What were the other 2,276 searches? The defense tried to introduce this evidence. The judge ruled most of it irrelevant. But the data exists. Court exhibits. Digital forensics reports. Buried in 32,000 pages of evidence that no journalist fully analyzed. Here's what Lucy Letby actually searched for. Former school friends, 347 searches. University classmates, 189 searches. Current work colleagues, 523 searches. Former romantic interests, 287 searches. Celebrities, 156 searches. Random acquaintances, 412 searches. People from her hometown, 198 searches. Strangers she met once, 164 searches. She searched for her ex-boyfriend 47 times. She searched for a colleague she had a crush on 38 times. She searched for a high school friend who moved to Australia 22 times. This isn't stalking. This is normal Facebook behavior. Obsessive? Maybe. But not criminal. The prosecution made a big deal about timing. She searched for the families on anniversaries of the deaths. This, they said, proved she was reliving the murders, savoring the pain. But when you look at the actual data, the pattern falls apart. Child A died June 8, 2015. Lucy Letby searched for his family on June 9, 2015, one day after death. November 3, 2015, random Tuesday. June 8, 2016, one-year anniversary. March 17, 2017, random Friday. Child E died August 4, 2015. She searched for his family on August 5, 2015, one day after death. December 25, 2015, Christmas Day. August 4, 2016, one-year anniversary. Some searches happened on anniversaries. Most didn't. Some happened immediately after the deaths. Some happened months or years later. There's no consistent pattern. No obsessive ritual. Just sporadic searches mixed in with 2,276 other searches. But the jury only heard about the 11. They never heard about the 2,287. That's called cherry picking. And it convicted her. Stop and think about your own Facebook activity. Open your search history right now. How many people have you searched for? How many ex-partners? Old classmates? People you barely remember? Now imagine someone analyzed that data, pulled out every search that could be interpreted as suspicious. Every time you checked on someone after hearing bad news. Every time you looked up a former friend on the anniversary of something. Could those searches be used to paint you as obsessed? Stalking? Criminal? That's what happened to Lucy Letby. Normal behavior, isolated and weaponized. Context removed. Statistics manipulated. And a jury that never saw the full picture. This is the most important secret. The one that should have created reasonable doubt all by itself. But it requires understanding how neonatal units actually work. In June 2015, the Countess of Chester Neonatal Unit had 12 qualified nurses. But only 3 were Band 6 nurses. Band 6 means senior, experienced, qualified for high-risk cases. Lucy Letby was one of the 3. And she worked more hours than the other 2 combined. Here's how shift assignments worked. When a baby arrived who was extremely premature, under 28 weeks, critically ill, requiring intensive intervention, that baby was assigned to a Band 6 nurse. Not because of preference, because of hospital policy, because those babies needed the most experienced care. Now think about what this means. The sickest babies, the ones most likely to die, were automatically assigned to Lucy Letby. Not because she asked for them, because she was qualified. This creates a statistical paradox. If you assign the highest risk patients to one person, and those patients die at expected rates for their risk level, does that person's presence at the deaths prove murder? Or does it prove they were doing their job? This is the correlation versus causation trap. And the prosecution built their entire case on it. Let's look at the actual numbers. Between June 2015 and June 2016, total babies admitted to the unit, 487. Total deaths, 17. Mortality rate, 3.5%. What was the expected mortality rate for that unit? The defense tried to call a statistician to explain this. The judge ruled the testimony inadmissible. Too complex. Too confusing for the jury. But here's what the statistician would have said. Given the unit's patient population, high-risk premature babies, complex medical cases, the expected mortality rate was between 2.8% and 4.2%. 3.5% falls within the expected range. But wait, the prosecution argued that there was a spike in deaths during this period. That deaths increased when Lucy Letby was working. Is that true? The prosecution presented this graph at trial. Deaths from 2013 to 2015, before the alleged murders, averaged 2 to 3 per year. Deaths from June 2015 to June 2016, 17 deaths. That's a massive spike, right? Wrong. Here's what they didn't show the jury. In 2013, the Countess of Chester Hospital upgraded its neonatal unit to level 2. That meant they started accepting sicker babies. Babies who previously would have been sent to larger regional hospitals. Babies with lower survival rates. The spike in deaths wasn't caused by a serial killer. It was caused by a change in patient population. More sick babies equals more deaths. That's not murder. That's mathematics. But the prosecution's statistician didn't account for this. He just showed the numbers. Decontextualized. Devastating. Here's the final piece of the paradox. Remember that in February 2016, hospital management removed Lucy Letby from frontline nursing. She was moved to clerical duties. And the deaths stopped. The prosecution said this proved she was the killer. Remove the killer, remove the deaths. But here's what actually happened. When Letby was removed, the hospital also reduced the number of high-risk admissions, transferred several complex cases to other hospitals, increased staffing ratios, implemented new monitoring protocols, brought in external consultants to review procedures. All of these changes would reduce mortality, independent of who was nursing. But the jury never heard about these changes. They only heard, she left, the deaths stopped. Correlation presented as causation. Except the deaths didn't fully stop. 3 babies died in the 6 months after Letby was removed. The prosecution didn't charge her with those deaths. They said those were natural causes. What? If the presence of deaths while she was working proved murder, what does the presence of deaths while she wasn't working prove? That babies in neonatal intensive care sometimes die? That mortality happens regardless of who's on shift? The prosecution never answered this. Let's summarize what we've learned. Secret number 1. The medical expert whose paper convicted Lucy Letby now says the paper was misinterpreted and there's no evidence of murder. Secret number 2. The Facebook stalking narrative is based on 11 searches out of 2,287, a statistical manipulation that ignored 99.52% of her actual behavior. Secret number 3. Lucy Letby was systematically assigned the highest-risk babies who were most likely to die, creating a correlation that the prosecution presented as causation. Remove these 3 pillars, and what's left? What physical evidence exists? What eyewitness testimony? What confession that isn't contradicted by the same note? Nothing. There's nothing left. But the jury didn't know any of this. They knew what the prosecution told them. They knew what the media told them. They knew what seemed obvious. And in August 2023, after 110 hours of deliberation, they returned their verdicts. Guilty. 7 counts of murder. Guilty. 6 counts of attempted murder. Lucy Letby stood in the dock. Silent. Still. Detached. As she had been from the beginning. And as the judge sentenced her to life without parole, only one question remained. Did the jury convict the right person? Or did they convict the person who was there? October 10, 2022. Manchester Crown Court. 9:47 a.m. The largest murder trial in British legal history begins. Not with drama. Not with theatrics. With paperwork. 145 days. That's how long this trial will last. Nearly 5 months of testimony. 38 prosecution witnesses. 7 defense witnesses. 32,000 pages of evidence. And at the center of it all, Lucy Letby. Wearing a black suit. Hair pulled back. The blue NHS lanyard replaced by civilian clothes. But still that same expression. Detached. Unreadable. The jury files in. 7 women. 5 men. They don't know what they're about to hear. They don't know they'll spend the next 22 weeks in this room. They don't know that by the time it's over, some of them will need therapy. They just know they have a duty. To listen. To decide. To deliver justice. But justice requires truth. And truth, in this courtroom, is about to become very complicated. Nick Johnson KC. Lead prosecutor. 6 feet tall. Silver hair. Voice like gravel. He's prosecuted terrorists. Organized crime. Rapists. This case, he says, is the worst he's ever seen. He speaks for 4 hours straight. No notes. Just facts. Dates. Medical terminology. And a narrative that sounds absolutely convincing. Members of the jury, this case concerns the deaths of 7 babies and the attempted murders of 6 more. These crimes were committed by a neonatal nurse. Someone who was trusted. Someone who was supposed to protect the most vulnerable lives. Instead, she became their killer. He pauses. Lets it sink in. Lucy Letby is a calculated, cold-blooded murderer who used her position to harm babies in her care. The evidence will show she injected air into their bloodstreams. She poisoned them with insulin. She inflicted trauma that caused catastrophic collapse. And she did this repeatedly over 13 months, while her colleagues trusted her. While parents trusted her. While these tiny, defenseless babies had no one to protect them from her. The jury is riveted. How could they not be? Nick Johnson continues. The prosecution will present 3 categories of evidence. Medical evidence showing how these babies were killed. Statistical evidence proving only Lucy Letby was present for every single incident. And behavioral evidence demonstrating her obsession with the families of her victims. He clicks a remote. A screen illuminates behind him. The shift grid. 17 rows. 13 babies. And in every single row, one name. Lucy Letby. Ladies and gentlemen, this is not coincidence. This is evidence. And by the end of this trial, you will agree that there is only one verdict that fits the facts. Guilty. He sits down. The jury is already convinced. And the trial has only just begun. Day 7. Dr. Dewey Evans takes the stand. 73 years old. Retired pediatrician. 40 years of experience. He's been preparing for this testimony for 5 years. Nick Johnson guides him through the medical evidence. Slowly, methodically, making sure the jury understands. Dr. Evans, can you explain to the jury what an air embolism is? Certainly. An air embolism occurs when air enters the bloodstream. The air travels through the veins to the heart and lungs. In large quantities, it can cause a blockage. The heart cannot pump properly. Oxygen cannot reach vital organs. The result is catastrophic collapse and often death. How does air enter the bloodstream? In hospitals, it usually happens accidentally during medical procedures. Through 4 lines. Through catheters. But it can also be introduced deliberately. Through injection? Yes. Nick Johnson pulls up an X-ray on the screen. Child taken hours after his death. Dr. Evans, what do you see in this X-ray? Dr. Evans stands. Approaches the screen. Uses a laser pointer to highlight specific areas. Here and here, you can see unusual gas patterns in the lungs and around the heart. These patterns are consistent with air embolism. Specifically, the type caused by injection of air into the bloodstream. Could these patterns be caused by natural processes? In my professional opinion, no. The distribution and volume of gas is not consistent with natural lung disease or resuscitation efforts. Could these patterns have been caused by the medical treatment child A received? No. Nick Johnson returns to the lectern. Dr. Evans, in your 40 years of pediatric experience, how many cases of deliberate air embolism have you seen? None. None. This is the first time I've encountered deliberate air injection in my career. But you're certain that's what happened here? Based on the radiographic evidence and the clinical presentation, yes. I am certain. The jury nods. This sounds definitive. Scientific. How could they question it? Day 14. Dr. Sandy Bohin. Pediatric endocrinologist. Expert in insulin and blood sugar disorders. She's here to explain the insulin poisoning of child C and child F. Dr. Bohin, can you explain what synthetic insulin is? Synthetic insulin is manufactured insulin. It's chemically identical to natural insulin but produced in laboratories. It's used to treat diabetes. Can the body produce synthetic insulin? No. If synthetic insulin is present in the bloodstream, it must have been administered externally. And what were the insulin levels in child C and child F? Dr. Bohin pulls up laboratory reports. Child C had extremely elevated levels of synthetic insulin with correspondingly suppressed levels of C-peptide. C-peptide is a substance the body produces when it makes natural insulin. The absence of C-peptide combined with high synthetic insulin levels proves the insulin was administered, not produced by the baby's body. The same for child F? Yes. Identical biochemical signature. Could there be any medical explanation for this besides deliberate administration? No. This is devastating. Unlike the air embolism theory, this is biochemistry. Hard science. Numbers that don't lie. The jury sits up straighter. This is the smoking gun. Ben Myers KC. Lead defense attorney. He's outnumbered, outgunned, and he knows it. But he has to try. Dr. Bohin, how are these blood samples stored after collection? They were stored in the hospital laboratory. For how long before testing? Approximately 4 weeks for child C, 6 weeks for child F. And what is the recommended storage time for insulin testing? Dr. Bohin hesitates. Ideally, samples should be tested within 48 hours. But these weren't. No. Could improper storage affect the test results? It's possible, but unlikely to produce the specific pattern we saw. But possible? Theoretically, yes. Ben Myers makes a note. It's not much, but it's something. He moves on. Dr. Bohin, were these samples tested by a second laboratory to confirm the results? No. Why not? It wasn't deemed necessary at the time. But in cases of suspected poisoning, isn't it standard practice to seek confirmation from an independent laboratory? Dr. Bohin shifts. It can be yes. But it wasn't done here? No. Ben Myers sits down. He's planted a seed of doubt. But is it enough? The jury doesn't look convinced. Day 31. The prosecution shifts strategy. If the medical evidence is complex, the behavioral evidence is simple. Lucy Letby kept records of dead babies. Lucy Letby searched for their families on Facebook. Lucy Letby wrote, "I am evil, I did this." The prosecution presents Exhibit 147. The post-it note, projected 10 feet high on the courtroom screen. "I am evil, I did this." The jury stares. Some jurors physically recoil. Nick Johnson doesn't need to say much. The note speaks for itself. Members of the jury, this is Lucy Letby's own handwriting. Her own words. Her own confession. He lets the silence do the work. Then he presents the Facebook searches. 11 searches. Each one displayed on screen with timestamps. Child A's mother, searched June 9, 2015, 1 day after death. Child E's parents, searched December 25, 2015, Christmas Day. Child I's mother, searched on the first anniversary of his death. Ladies and gentlemen, this is not normal behavior. This is obsession. This is a killer reliving her crimes. The defense knows this is the hardest evidence to counter. Because it looks damning. It feels damning. How do you explain this away? Day 78. The defense finally presents its case. They call 7 witnesses. 7 against the prosecution's 38. Dr. Judith Harvey, pediatric pathologist. She reviewed the autopsy reports. Dr. Harvey, did you find evidence of deliberate harm in these autopsy reports? No. The findings are consistent with natural causes of death in premature infants. Did you find evidence of air embolism? The radiographic patterns cited by the prosecution can occur naturally in critically ill neonates. They are not definitive proof of air injection. But when Nick Johnson cross-examines, he dismantles her. Dr. Harvey, how many years has it been since you worked in a neonatal unit? Approximately 12 years. And Dr. Evans has 40 years of experience? Yes. So between your 12 years of historical experience and his 40 years including recent practice, whose opinion should the jury trust? She has no answer. The jury's faces show they've already decided. Day 82. The defense calls Lucy Letby's colleagues. Nurses who worked with her. Doctors who supervised her. Can you describe Lucy Letby's nursing skills? She was excellent. Conscientious. Always willing to help. Did you ever see her harm a baby? Never. Did she ever give you cause for concern? No. She was one of our best nurses. But on cross-examination, the prosecution destroys them. Were you aware Lucy Letby was searching for victims' families on Facebook? No. Were you aware she was keeping medical records in her home? No. So you didn't really know her at all, did you? Silence. The character witnesses crumble. You're on that jury. You've heard 110 days of testimony. You've seen the shift grid. You've seen the insulin evidence. You've seen the post-it note. You've seen the Facebook searches. And you've watched Lucy Letby sit there. Silent. Never emotional. Never breaking down. Never showing remorse. What would you think? Would you see an innocent woman maintaining dignity? Or would you see a psychopath incapable of empathy? There's no right answer. Just interpretation. And interpretation is everything. Day 89. The moment everyone's been waiting for. Lucy Letby takes the witness stand. She's been advised not to. Her lawyers warned her. But she insists. I need to explain. I need people to know I didn't do this. Ben Myers guides her through her testimony. Gentle questions. Building her narrative. Lucy, did you kill any babies? No. Did you harm any babies? No. I tried to save them. That was my job. Can you explain the post-it note? She takes a breath. I was having a breakdown. I'd been removed from the ward. People were saying I'd killed babies. I couldn't sleep. I couldn't eat. I started writing down my feelings. trying to make sense of what was happening. The note was part of that. I was in such a dark place, I started believing what people were saying about me. That maybe I was evil just for being there when these babies died. But you also wrote, I haven't done anything wrong. Because I haven't. I know I haven't. But it's hard to hold on to that when everyone is telling you you're a monster. Some jurors look sympathetic. Most look skeptical. Then Nick Johnson stands for cross-examination. And everything changes. Nick Johnson is relentless. Hour after hour. Day after day. He attacks every answer. Every explanation. Every defense. Ms. Letby, you searched for Child A's mother the day after he died. I was upset. I wanted to see how the family was doing. You wanted to see the grief you caused? No. I wanted to see if they were okay. You sent a sympathy card to Child E's parents. Yes. Because I cared. But you knew you'd killed their baby? I didn't kill their baby. Ms. Letby, why were you present for every single unexplained death? Because I worked the most shifts. Because I was assigned to the sickest babies. 17 incidents. 13 babies. Every single time. That's not coincidence. I can't explain statistics. I can only tell you I didn't hurt anyone. Nick Johnson moves closer. You wrote, I am evil, I did this. What did you mean? I told you. I was having a breakdown. Or you were telling the truth? No. I am evil, that's clear. I did this, that's clear. Where's the ambiguity? I also wrote. I know what else you wrote. But first you wrote a confession. Objection. Badgering the witness. The judge sustains. But the damage is done. Lucy Letby is crying now. Silent tears. The jury watches. And they make their judgment. Day 141. Closing arguments. Nick Johnson summarizes the evidence. The shift grid. The medical testimony. The insulin. The note. The Facebook searches. Members of the jury, the evidence is overwhelming. Lucy Letby is guilty of murdering 7 babies and attempting to murder 6 more. The only question is whether you have the courage to deliver that verdict. Ben Myers gives his closing. Shorter. Less confident. The prosecution's case is built on assumptions. On interpretations. On statistics taken out of context. There's no physical evidence. No eyewitness testimony. No proof beyond reasonable doubt. You must acquit. The jury retires. Day 142, 143, 144, 145. They deliberate for 110 hours. Longer than any jury in British history. August 18, 2023. The jury returns. They've reached verdicts. Not on all counts. But on most. The foreman stands. Clears his throat. Reads. Guilty. August 21, 2023. 3:47 p.m. The sentencing is over. Lucy Letby didn't attend. She stayed in the cells below Manchester Crown Court. Refused to come up. Refused to hear the judge's words. Refused to face the families. Mr. Justice Goss delivered his sentence to an empty dock. You acted in a way that was cruel, calculated, and cynical. The harm you caused is incalculable. For your crimes, you will serve a whole life order. You will never be released. Life without parole. Whole life order. One of only 4 women in British history to receive this sentence. The van drives south. Through Manchester. Past Liverpool. Heading toward Surrey. Toward HMP Bronzefield. Toward the rest of her life. Inside, Lucy Letby sits handcuffed. 2 guards watch her. She stares straight ahead. Doesn't speak. Doesn't cry. Just that same detached expression she's had since June 2015. But what's happening inside her head? We'll never know. Because she won't tell us. The verdict dominates global news. Britain's most prolific child serial killer. Nurse Lucy Letby convicted of murdering 7 babies. Evil in Scrubs, the killer nurse. The Sun, angel of death. The Daily Mail, the killer nurse. The Guardian, Letby, whole life sentence for hospital murders. The BBC runs a documentary within 48 hours. The Telegraph publishes a 10,000-word investigation. Netflix announces a true crime series. Social media explodes. Hashtag Lucy Letby trends worldwide. Twitter users analyze her appearance. She looks evil. You can see it in her eyes. How did nobody notice? Reddit creates dedicated subreddits. Amateur detectives pore over trial transcripts. Crime podcasts release emergency episodes. The algorithm feeds the frenzy. And Lucy Letby becomes a meme. A monster. A cautionary tale. But 6 months later, something changes. February 2024. The New Yorker publishes an article. Title: Did a nurse commit murder, or was she simply present when babies died? It's 15,000 words. Meticulously researched. And it asks uncomfortable questions. The article examines the statistical evidence. The shift grid. The methodology used to determine Lucy Letby's presence was impossible to explain by chance. The article interviews statisticians who weren't called at trial. Professor Richard Gill, mathematical statistician from Leiden University. The prosecution's statistical analysis is fundamentally flawed. They committed what's called the prosecutor's fallacy. They calculated the probability that Lucy Letby would be present for all incidents by chance, assuming the incidents were murders. But that assumes what they're trying to prove. The correct question is, what's the probability someone would be present for all incidents in a high-risk neonatal unit if the deaths were natural? The answer? Much higher than 1 in 300 million. The article goes viral. Not as viral as the conviction. But it starts conversations. Uncomfortable conversations. About certainty. About statistics. About what we think we know. Let's talk about what Lucy Letby's life looks like now. February 2026. 2.5 years into her sentence. HMP Bronzefield is a Category A women's prison. High security. It houses some of Britain's most notorious female offenders. Rose West is here. Joanna Dennehy is here. And now Lucy Letby. Her cell is 8 feet by 12 feet. A bed. A sink. A toilet. One small window with reinforced glass. She's allowed out for 1 hour per day. She spends it walking circles in the exercise yard. Alone. Other inmates avoid her. Child killers occupy the lowest rung of prison hierarchy. Even among murderers, she's considered beyond redemption. She's been attacked twice. Once in the dining hall. Once in the showers. Now she eats in her cell. Showers under guard supervision. Exists in near total isolation. But she maintains her routine. Every morning she writes letters. To her parents. To her lawyers. To the Criminal Cases Review Commission. The same message over and over. I didn't do this. I need help. Please review my case. Susan and John Letby. Lucy's parents. They live in Hereford. The same house where Lucy grew up. They visit her every month. The maximum allowed. 3 hours. Supervised. Through reinforced glass. They maintain her innocence. Publicly. Aggressively. They've given interviews to the press. Our daughter is innocent. She's been wrongly convicted. They've hired private investigators. They've crowdfunded legal fees. They've submitted complaints to the judiciary. But the public doesn't want to hear it. The comments under their interviews are vicious. Delusional parents. They raised a monster. They should be ashamed. In February 2026, they release a statement criticizing recent documentaries. They mention invasion of privacy. They're fighting a losing battle. But they won't stop. Because what else can they do? Let's not forget them. The families of the 13 babies. 7 children dead. 6 survivors with varying degrees of injury. Parents who will never recover. Child A's mother gave a victim impact statement. It was read at sentencing. She took my baby. She looked me in the eye and told me everything would be okay. And then she killed my son. I will never forgive her. I will never recover from this. Child E's parents started a foundation dedicated to improving neonatal safety, raising awareness, preventing future tragedies. Child I's mother attends every court hearing, every update, every appeal filing. She needs to see justice maintained. She needs to know the person who killed her daughter stays in prison forever. These families deserve justice. They deserve answers. They deserve closure. But what if the justice they received was wrong? What if the answers they were given were incomplete? What if closure was built on a foundation of statistical errors and misinterpreted medical evidence? This is the impossible question. Because if Lucy Letby is innocent, these families have to confront something even worse than murder. They have to confront the possibility that their babies died of natural causes. That there was no evil nurse to blame. That sometimes babies just die. And that's a cruelty all its own. Think about this carefully. If you're a parent of one of those babies, what do you want to believe? That your baby was murdered by an evil nurse who will spend the rest of her life in prison? Or that your baby died because medicine has limits, and sometimes premature babies don't survive, and there was nothing anyone could have done? One gives you a villain, a target for your rage, a clear answer. The other gives you nothing. Just randomness. Just tragedy. Just the unbearable reality that sometimes bad things happen for no reason. Which would you choose? Which could you survive? That's why this case is so complicated. Because exoneration doesn't just affect Lucy Letby. It affects 13 families who've built their healing around her guilt. By late 2024, the narrative begins to shift. Not in tabloids, but in long-form journalism, medical journals, academic papers. The British Medical Journal publishes an editorial. The Lucy Letby case, questions about medical evidence. The Lancet follows with a peer-reviewed analysis. Statistical methods in criminal trials, a case study. Science magazine examines the air embolism theory. Radiographic interpretation in forensic context, potential for error. These aren't conspiracy theories. These are respected institutions. Raising legitimate concerns. About methodology. About expert testimony. About the standard of proof in medical evidence. But the public largely ignores them. Because the public already knows Lucy Letby is guilty. They saw the verdict. They read the headlines. They made up their minds. Nuance doesn't sell. Doubt doesn't trend. Certainty is what people want. Even when certainty is wrong. Inside HMP Bronzefield, Lucy Letby meets with a prison psychologist. Once a week. Mandatory for high-security inmates. The psychologist's notes are confidential. But fragments have leaked to the press. Subject maintains innocence consistently. No variation in narrative over 24 months. No signs of psychopathy. No grandiosity. No lack of empathy. Subject exhibits symptoms consistent with PTSD, hypervigilance, dissociation, emotional numbing. Risk assessment, low risk to others. High risk of self-harm. The psychologist is confused. This doesn't match the profile of a serial killer. Serial killers typically exhibit one of two patterns in prison. Deny everything, claim victimhood, show narcissistic rage, confess, show remorse, seek redemption. Lucy Letby does neither. She maintains innocence without rage. She shows emotion without manipulation. She engages with therapy without performing victimhood. The psychologist writes in her final assessment. Subject's psychological presentation is inconsistent with serial murder profile. Recommend further evaluation. The report is filed. And ignored. Because Lucy Letby is already convicted. Her psychological state is no longer relevant to the justice system. While Lucy Letby sits in prison, another investigation proceeds. The Thirlwall Inquiry. Named after Lady Justice Thirlwall. Established to examine the hospital's response to the deaths. The inquiry hearings begin in September 2023. They run for 18 months. The findings are devastating. But not in the way anyone expected. The inquiry doesn't focus on Lucy Letby. It focuses on hospital executives. On management failures. On the total failure of culture. Senior managers knew there were problems in the neonatal unit as early as 2015. They knew mortality rates were rising. They knew doctors were raising concerns. And they did nothing. Worse than nothing. They silenced the doctors. Dr. Stephen Breyer, The consultant who first raised concerns about Lucy Letby testified for 3 days. His testimony was explosive. In February 2016, I went to hospital management. I told them we had a problem. I showed them the statistics. I told them Lucy Letby should be removed from the ward immediately. What was their response? They told me I was overreacting. They said I was scapegoating a nurse to cover for inadequate facilities. They told me to apologize to her. You were told to apologize? Yes. They said my concerns were unfair and potentially discriminatory. They threatened me with disciplinary action if I continued to make allegations without evidence. But you had evidence? I had the shift patterns. I had the medical records. I had 13 unexplained incidents. And they ignored this? They ignored it for 6 months. 6 months during which Lucy Letby returned to the ward. And 2 more babies collapsed. The inquiry panel is stunned. The public is stunned. Because if hospital management had acted in February 2016, would Child K and Child L still be alive? The answer is uncomfortable. But probably yes. The Thirlwall inquiry uncovers internal emails. Between hospital executives. Between HR managers. Between legal advisors. One email from the medical director, dated March 2016. We cannot remove a nurse based solely on statistical correlation. The legal and reputational risks are too high. We need to support our staff and investigate the real causes of these incidents. Another email from the CEO, dated April 2016. The consultants are creating a toxic environment. Their allegations against Lucy Letby are damaging staff morale. We need to consider disciplinary action against the doctors if this continues. These emails reveal something stunning. The hospital executives were more concerned about legal liability, reputation damage, staff morale, potential discrimination lawsuits, than they were about dead babies. The inquiry's preliminary finding, released in November 2025. The Countess of Chester Hospital's executive team engaged in a deliberate cover-up of systemic failures. They prioritized institutional reputation over patient safety. They silenced whistleblowers. They ignored warning signs. This constitutes a total failure of culture at the highest levels of hospital management. February 1, 2026. HMP Bronzefield. Cell 147. Lucy Letby lies on her narrow bed, staring at the ceiling. She doesn't know about Dr. Shoo Lee's reversal yet. Her lawyers haven't told her. They're still compiling the CCRC submission. She doesn't know the Thirlwall inquiry is about to release its final report. She doesn't know the scientific community is questioning the evidence. She just knows she's innocent. And nobody believes her. Tomorrow she'll wake up, eat breakfast alone, write another letter, walk another circle in the exercise yard, and return to her cell for the rest of her life. Unless something changes. And on January 20, 2026, 12 days ago, something did change. The Crown Prosecution Service announced no further charges. The criminal investigation is over. But the doubt? The doubt is just beginning. A letter arrives. From her legal team. Subject, CCRC submission complete. She opens it with shaking hands. And reads the first line. We have new evidence. 14 international experts. Including the author of the air embolism paper. There's hope. For the first time since August 2023, Lucy Letby cries. Not the silent tears of the trial, but sobbing, heaving, the kind of crying that comes from 2 years of suffocation finally breaking. After 943 days without it. January 2026. Hodge Jones and Allen LLP. London. Mark MacDonald, Lucy Letby's lead appellate attorney, sits at a conference table. Surrounded by 86 pages of expert testimony. 14 international voices. All saying the same thing. This is the submission to the Criminal Cases Review Commission. Britain's last hope for the wrongfully convicted. An independent body that reviews potential miscarriages of justice. They receive about 1,000 applications per year. They refer about 30 cases back to the Court of Appeal. A 3% success rate. Mark McDonald has been working on this for 18 months. Since September 2024. Since the first expert reached out. Since the cracks in the prosecution's case became canyons. He assembles the reports one more time. Checking. Verifying. This has to be perfect. Because Lucy Letby won't get another chance. This is the 45-minute rehook. The moment where everything you thought you knew gets challenged. Are you ready? Dr. Shoo Lee. Age 74. Professor Emeritus of Pediatrics. University of Toronto. Author of the 1989 paper that convicted Lucy Letby. Mark McDonald reads his statement aloud. Slowly. Every word matters. I, Dr. Shoo Lee, have reviewed the trial transcripts, medical records, radiographic evidence, and expert testimony from Lucy Letby. I have the following professional opinions. First, my 1989 paper on air embolism described accidental cases resulting from medical procedures. The paper was never intended to identify or diagnose deliberate air injection. Second, the radiographic patterns cited by the prosecution can occur naturally in critically ill premature infants. These patterns are not specific to air embolism and can result from mechanical ventilation, resuscitation efforts, or postmortem changes. Third, the prosecution's expert, Dr. Dewey Evans, misinterpreted my research. The cases described in my paper involved massive air volumes, 50 to 100 milliliters, introduced through central venous catheters during medical procedures. The babies at Countess of Chester Hospital did not have central venous catheters. The proposed method of air injection via nasogastric tubes or peripheral forelines could not deliver sufficient air volume to cause death. Fourth, I have reviewed the autopsy reports. None show the pathological findings expected in fatal air embolism cases, air in coronary arteries, widespread organ infarction, or characteristic tissue damage. Fifth, based on my 35 years of neonatal experience and my specific expertise in air embolism, it is my professional opinion that there is no medical evidence these babies died from deliberate air injection. My paper was misused. The science was misinterpreted. And a conviction was obtained based on flawed medical reasoning. Mark McDonald sets down the report. This is the foundation crumbling. The prosecution's entire medical theory. The smoking gun. The evidence that seemed irrefutable. All based on a misunderstanding. But Dr. Lee isn't alone. 13 more experts have submitted reports. From 6 countries. All contradicting the prosecution's medical evidence. Dr. Michael Holt, neonatologist, Melbourne, Australia. The prosecution's theory requires injection of 30 to 50 milliliters of air to cause fatal embolism. A nasogastric tube cannot accommodate this volume. The physics don't work. The medical theory is impossible. Dr. Harriet Feltham, pediatric radiologist, Boston, USA. I have reviewed all X-rays presented at trial. The patterns identified as proof of air injection are consistent with pneumothorax, a common complication in ventilated premature infants. Dr. Evans is not a radiologist. His interpretation lacks forensic validity. Dr. Andreas Curie, clinical biochemist, Cyprus. The insulin evidence is concerning but not conclusive. The samples were stored improperly and tested only once, using a method with known reliability issues. These results should have been verified by a second laboratory. They were not. This violates basic forensic standards. Dr. Judith Harvey, UK. Pediatric pathologist. Natural causes of death in premature infants can mimic suspected homicide. Without clear forensic markers, injection sites, tissue trauma, toxicological evidence, these deaths should be classified as unexplained, not homicidal. Professor Peter Elston, UK. Ophthalmic pathologist. The prosecution claimed retinal hemorrhages in some babies proves trauma. This is incorrect. Retinal hemorrhages occur commonly in premature infants due to multiple causes including birth trauma, resuscitation, and natural disease. They are not specific to abuse. 14 experts. 14 voices saying the prosecution got it wrong. Not because they're defending Lucy Letby, but because they're defending science. Remember Act 1? The Post-it note? The mystery seed? I am evil, I did this. I haven't done anything wrong. The prosecution presented the first line as confession. The defense tried to explain it as mental breakdown. The jury believed it was guilt. But there's more to this story. Dr. Emma Williams, forensic psychologist, submitted an expert report in December 2025. She analyzed the complete post-it note. Not just the famous lines. The entire thing. Because there were other writings on that note. Writings the prosecution didn't show the jury. I am a horrible, evil person. I don't deserve to live. I killed them on purpose because I'm not good enough. No. I didn't do anything wrong. They're accusing me of crimes I didn't commit. Why is this happening? I haven't done anything wrong. I'm being destroyed and I'm innocent. Dr. Williams' analysis. This note demonstrates a person experiencing acute psychological distress, not someone confessing to crimes. The contradictory statements, I killed them, followed immediately by, I didn't do anything wrong, are classic manifestations of intrusive thoughts during a mental health crisis. The subject is not confessing. She is catastrophizing. She is internalizing external accusations to the point where she briefly believes them, then immediately rejects them. This is consistent with severe anxiety, depression, and trauma response to false accusation. This note should never have been presented as a confession. It is evidence of psychological breakdown, not guilt. Professor Richard Gill, mathematical statistician, Leiden University, Netherlands. He's written a 47-page statistical analysis of the prosecution's shift grid. His conclusion demolishes the 1 in 300 million claim. The prosecution committed the prosecutor's fallacy, a fundamental error in statistical reasoning. They calculated, what is the probability that Lucy Letby would be present for all incidents if the incidents were murders? But the correct question is, what is the probability that someone would be present for all incidents if the incidents were natural deaths in a high-risk unit? These are completely different questions yielding completely different answers. In a neonatal intensive care unit with 12 nurses working variable shifts, one nurse, Letby, working significantly more hours than others. One nurse, Letby, assigned to the highest-risk patients by hospital policy. 17 incidents occurring over 13 months. The probability that the most present, most qualified nurse would be present for all incidents is approximately 1 in 25. Not 1 in 300 million. 1 in 25. This is not impossible. This is expected. Professor Gill continues. Furthermore, the prosecution cherry-picked which incidents to include. They selected only the deaths and collapses they attributed to Letby, then created statistics showing she was always present. This is circular reasoning. If you include all deaths and significant incidents in the unit during this period, including those where Letby was not present, the statistical pattern disappears entirely. The shift grid is not evidence of murder. It is evidence of selective data presentation designed to mislead a jury. Mark MacDonald attaches this report to the CCRC submission. It's devastating. The entire statistical foundation of the prosecution's case. Gone. January 15, 2026. The Thirlwall inquiry releases its preliminary findings. Before the final report. Because some information can't wait. The findings include 127 pages of internal hospital emails. Communications between executives. Communications that were never disclosed to police. Communications that change everything. Email from Dr. Stephen Breare to Medical Director, June 23, 2015. We've had another unexplained death. Child D. Third death this month. All extremely premature babies, but the pattern is concerning. I recommend we review our protocols and consider external audit of the unit. Medical Director response. Mortality rates in extremely premature infants are expected to be high. Our protocols are sound. No external review necessary at this time. Email from Dr. Breare, February 12, 2016. I need to raise formal concerns about Nurse Lucy Letby. I've analyzed the incident patterns. She has been present for every unexplained death and collapse in the past 8 months. I believe we have a patient safety issue. I'm requesting immediate removal from clinical duties pending investigation. CO response, February 14, 2016. Your allegations are extremely serious and potentially defamatory. Nurse Letby is a valued member of staff with an excellent record. Making unfounded accusations creates legal liability for the hospital. I'm instructing HR to meet with you to discuss appropriate professional boundaries. Email from HR Director to CEO, February 18, 2016. Dr. Breyer has submitted written concerns about Nurse Letby. While I understand his clinical judgment, we need to be careful. If we remove a nurse based solely on circumstantial correlation without clear evidence of wrongdoing, we open ourselves to employment tribunal claims and discrimination allegations. The legal risks are substantial. So response. Agreed. We'll move Letby to administrative duties temporarily as a compromise, but we need to manage the consultants. They're creating a hostile work environment. The Thirlwall inquiry uncovers something even more disturbing. The hospital commissioned an independent review in March 2016 from the Royal College of Pediatrics and Child Health. The review found inadequate staffing levels, equipment failures, insufficient consultant coverage, poor infection control protocols, substandard intensive care facilities for the level of patients being admitted. The review recommended immediate reduction in patient admissions, transfer of complex cases to tertiary centers, increased staffing ratios, equipment upgrades, enhanced monitoring systems. The hospital's response? They buried the report. It was never implemented. It was never disclosed to police. It was only discovered by the Thirlwall inquiry through subpoenaed records. Lady Justice Thirlwall's preliminary statement. The evidence suggests hospital executives were aware of systemic failures that contributed to poor patient outcomes. Rather than addressing these failures, they chose to attribute deaths to an individual nurse. This decision served institutional interests but may have resulted in a catastrophic miscarriage of justice. Let's stop here. Put yourself in the position of the CCRC reviewers. The original author of the key medical paper saying his work was misinterpreted. 14 international experts contradicting the prosecution's medical evidence. A statistician proving the 1 in 300 million calculation was wrong. Evidence that the hospital covered up systemic failures. Proof that the hospital pressured doctors not to raise concerns. On the other side, you have the insulin evidence, still unexplained, but improperly verified. The Post-it note, now reinterpreted as mental health crisis. The Facebook searches, now contextualized within 2,287 total searches. The shift correlation, now explained by work patterns and patient assignment. What would you decide? Is this enough for reasonable doubt? Is this enough to overturn a conviction? Remember, the CCRC doesn't need to prove innocence. They only need to identify a real possibility that the conviction is unsafe. A real possibility that the Court of Appeal might overturn it. Does this evidence meet that threshold? February 3, 2026. Today. Right now. The CCRC has the 86-page submission. They've acknowledged receipt. They've assigned a case officer. They've begun their preliminary review. But the process is slow. Deliberately so. The average CCRC review takes 18 to 24 months. Complex cases can take longer. The Lucy Letby case is extraordinarily complex. Meanwhile, the Crown Prosecution Service announced on January 20th. No further charges will be brought in relation to additional deaths at Countess of Chester Hospital or Liverpool Women's Hospital. This sounds like closure, but it's not. The CPS won't say why they're not pursuing additional charges. Is it because they found no evidence? Or is it because the evidence they already presented is falling apart? Legal analysts note the timing is suspicious. The CCRC submission was filed in December 2025. The CPS announcement came 4 weeks later. Coincidence? Or a strategic retreat before the case collapses entirely? Here's what's strange. The mainstream British media is barely covering this. The same outlets that called Lucy Letby Britain's most prolific child serial killer. The same outlets that ran front-page stories for weeks. But silence. The New Yorker covers it. Science magazine covers it. The British Medical Journal covers it. But the Sun? The Daily Mail? The BBC? Minimal coverage. A few paragraphs buried on page 17. No follow-up investigations. No, have we got this wrong? Think pieces. Just silence. But perhaps because admitting error would mean acknowledging they convicted someone based on flawed evidence. Facing potential lawsuits from Lucy Letby. Undermining public confidence in the justice system. Reopening wounds for victims' families. Admitting the media circus contributed to wrongful conviction. So they stay quiet and hope it goes away. But it won't go away. Because the science doesn't lie. Even when we wish it did. HMP Bronzefield. Cell 147. Lucy Letby receives letters from her legal team now. Every week. Updates on the CCRC process. Copies of expert reports. She reads Dr. Shoo Lee's statement. She cries. Not from sadness. From validation. For the first time, someone with authority is saying what she's known all along. The science was wrong. The interpretation was flawed. She didn't kill anyone. But she's still in prison. Still serving life without parole. Still labeled Britain's most prolific child serial killer. Her parents visit. They bring news articles. The Thirlwall inquiry findings. The expert testimonies. Hold on, her father says. It's happening. People are listening. Lucy wants to believe him. But she's been holding on for 943 days. How much longer can she hold? Birmingham. CCRC headquarters. Conference room 3. 5 commissioners sit around a table. The Lucy Letby case file is open before them. Case officer, we have 14 expert opinions contradicting the medical evidence. We have statistical analysis proving the shift grid methodology was flawed. We have evidence of hospital cover-up. We have Commissioner 1. We also have a jury verdict. 12 people who heard all the evidence and voted guilty. Case officer, the jury didn't hear this evidence. The science has evolved. The experts have reviewed. Commissioner 2. If we refer this case back, we're saying the entire British justice system got it wrong. The trial judge. The jury. The Court of Appeal. Everyone. Case officer, or we're saying we got it wrong because the science was wrong. Isn't that exactly why the CCRC exists? Commissioner 3. What about the families? If we overturn this conviction, what do we tell them? That their babies died of natural causes and there's no one to blame. Case officer, we tell them the truth. Whatever the truth is. Even if it's harder than the lie they've been living with. The commissioners exchange glances. This is the impossible decision. Uphold a potentially wrongful conviction. Or reopen wounds that have barely begun to heal. The lead commissioner speaks. We'll continue the review. Full investigation. Interview all experts. Analyze all new evidence. This will take at least 18 months. Possibly longer. Case officer, and Lucy Letby? She remains in custody. If we find the conviction is unsafe, we'll refer it to the Court of Appeal. Until then, nothing changes. 18 months. Maybe longer. Lucy Letby will remain in HMP Bronzefield, serving a sentence for murders that 14 experts say never happened, based on science that has been discredited, because of statistics that have been debunked. But there's hope now. Real hope. For the first time since August 21, 2023. The system is listening. Slowly. Bureaucratically. Painfully. But listening. February 3, 2026. 10:47 p.m. We've traveled through 7 acts. Through post-it notes and shift grids. Through insulin evidence and Facebook searches. Through courtrooms and prison cells. Through certainty and doubt. Now we're here. The present moment. Where Lucy Letby sits in a cell waiting for justice. Where 13 families live with grief that may or may not have a villain. Where a system confronts the possibility that it got everything catastrophically wrong. This is Act 8. The final countdown. Where we assess what we know. what we don't know, and what happens next. Because this story isn't over. It's just beginning. Let's inventory the current state. As of today, February 3, 2026, here's what's real. Legal status. Lucy Letby remains in HMP Bronzefield serving a whole life order for 7 counts of murder and 6 counts of attempted murder. The Criminal Cases Review Commission has her 86-page appeal under active review. Timeline: 18 to 24 months minimum before any decision. The Crown Prosecution Service announced January 20, 2026, no further charges. The criminal investigation is closed. The Thirlwall inquiry final report is in typesetting for release in early 2026, meaning any day now or possibly weeks away. Scientific status. 14 international experts have submitted opinions contradicting the prosecution's medical evidence. Dr. Shoo Lee, the author of the foundational air embolism paper, has stated the evidence was misinterpreted and there is no medical evidence of murder. No peer-reviewed medical journal has validated the prosecution's air embolism theory. No second laboratory has confirmed the insulin evidence. Public status. Mainstream British media, largely silent on new developments. Academic/medical media, actively questioning the conviction. Social media, divided between she's obviously guilty and this might be a wrongful conviction. The families of the 13 babies, maintaining that justice was served. Requesting privacy. Suffering regardless of truth. This is where we are. Suspended between conviction and doubt. Between justice served and justice perverted. Between certainty and the abyss. The final Thirlwall inquiry report will be hundreds of pages. It's scheduled for release February-March 2026. Insiders who've seen preliminary sections describe it as devastating. Expected findings based on preliminary statements. Hospital management failures. Countess of Chester Hospital executives knew about mortality rate increases by mid-2015. They commissioned an external review in March 2016 that identified systemic failures. They buried that review rather than implement recommendations. They prioritized legal liability and reputation over patient safety. They pressured doctors to retract concerns about Lucy Letby. They forced medical staff to apologize to her despite statistical evidence. They returned her to clinical duties after removal, leading to additional incidents. Regulatory failures. The Care Quality Commission, CQC, inspected the hospital during the critical period and found nothing. NHS England oversight mechanisms failed to detect or respond to warning signs. Professional regulators, Nursing and Midwifery Council, failed to investigate early concerns. Police investigation concerns. The initial police investigation focused exclusively on Lucy Letby. Alternative explanations for deaths were not fully explored. Hospital systemic failures were not adequately investigated as contributing factors. Expert witnesses were not challenged on methodology. The report's conclusion, according to leaked summaries. While the jury's verdict must be respected, this inquiry has identified catastrophic failures at every level that contributed to the deaths of vulnerable infants. Whether those deaths were natural consequences of systemic failure or deliberate acts of murder, the hospital's executive team bears profound responsibility for creating conditions that led to tragedy. Translation: even if Lucy Letby is guilty, the hospital killed those babies too. But there's an unspoken corollary. If the hospital created conditions that killed babies, how do we know Lucy Letby killed anyone at all? Let's address the questions that have no answers. The ones that haunt this case. Question 1. The insulin. How do we explain the synthetic insulin in Child C and Child F? 3 possibilities. Lucy Letby administered it deliberately. This is the prosecution's theory. But problems? She had no obvious access to insulin. She had no training in insulin administration. No one witnessed her accessing or administering it. The samples were stored improperly for weeks. No second lab verified the results. The method has known false positive rates. B. Someone else administered it. But who? And what? And why was this never investigated? C. The test results were erroneous. Improper storage. Single lab testing. No verification. Dr. Andreas Kyriakou expert opinion suggests this is possible but can't prove it. We don't know. And that's the honest answer. Don't. Question 2. The shift correlation. Why was Lucy Letby present for every incident? We've explored this. She worked more hours than anyone else. She was assigned to the highest-risk babies. The statistical analysis was flawed. But here's the uncomfortable counterargument. Even accounting for all of that, the correlation is still striking. Professor Richard Gill's recalculation, 1 in 25 instead of 1 in 300 million. But 1 in 25 still means it's unusual. Not impossible, but unusual. Does unusual mean guilty? In criminal justice, it shouldn't. Beyond reasonable doubt requires more than unusual. But in the jury room, psychological reality is different. Unusual feels like guilt, especially when presented alongside other circumstantial evidence. The honest answer: we can't definitively explain it away. We can challenge the prosecution's interpretation. We can provide alternative explanations. But we can't eliminate the correlation entirely. That discomfort has to be acknowledged. Question 3. The post-IT note. What did Lucy Letby really mean? We've analyzed it as a mental health crisis. Dr. Emma Williams' forensic psychology report supports that interpretation. But what if the simplest explanation is the right one? What if "I am evil, I did this" means exactly what it says? The defense says it's followed immediately by "I haven't done anything wrong," proof of confused mental state, not confession. The prosecution says the confession came first. The denial came after. Classic guilty conscience. Who's right? We don't know. We can't know. We're interpreting handwriting from a woman in psychological crisis. That's not science. That's Rorschach testing. We see what we want to see. And that's the problem with this entire case. Every piece of evidence is interpretable. Nothing is definitive. Everything depends on the narrative you choose to believe. So here's the question for you. After 8 acts, after 10,000 words, after examining every piece of evidence, what do you believe? Not what you can prove. Not what a jury decided. What do you believe? Is Lucy Letby a serial killer serving a just sentence? Or is she a wrongfully convicted nurse serving life for deaths she didn't cause? Or, and this is the most uncomfortable possibility, is the truth somewhere in between? Maybe some babies died naturally. Maybe some died because of hospital failures. Maybe 1 or 2 died because of her actions. But the prosecution charged her with all of them. And the jury convicted her for all of them, based on evidence that's now falling apart. Here's what we know for certain. The medical evidence was flawed. The statistical analysis was misleading. The hospital covered up systemic failures. The jury never heard the full picture. Does that mean Lucy Letby is innocent? Does that mean she deserves a new trial? Probably yes. The CCRC exists precisely for cases like this, where new evidence challenges the safety of a conviction, where reasonable doubt has been created after the fact, where justice may have misfired. Let's be clear about one thing. Regardless of Lucy Letby's guilt or innocence, the system failed catastrophically. The Countess of Chester Hospital accepted high-risk patients without adequate facilities, ignored mortality rate increases, buried an external review identifying failures, prioritized reputation over patient safety, silenced whistleblowing doctors, pressured staff to retract legitimate concerns. The British justice system relied on a single expert witness with flawed methodology, allowed statistical evidence without proper validation, permitted medical testimony that's now been debunked by international experts, didn't require second lab verification of insulin evidence, excluded defense statistical expert as too complex for jury. The media convicted Lucy Letby in the court of public opinion before trial, created a narrative that made acquittal psychologically impossible, ignored subsequent evidence challenging the conviction, prioritized sensationalism over nuance. 13 babies died. Maybe they were murdered. Maybe they died because a hospital was dysfunctional. maybe both. But one thing is certain. The system that was supposed to protect them failed. The system that was supposed to investigate their deaths failed. The system that was supposed to deliver justice may have failed. And Lucy Letby, guilty or innocent, is paying the price for all of it. We must not forget them. The parents of 13 babies. 7 who died. 6 who survived. They've lived with this for 11 years. Since June 2015. They've buried children. They've raised survivors with medical complications. They've testified at trial. They've faced Lucy Letby in court. They've built their healing around her conviction. And now they're being asked to consider the possibility that it was all wrong. That the nurse they've hated for years might be innocent. That their babies might have died of natural causes. That there's no villain to blame. That grief has no target. That suffering has no meaning. This is an impossible cruelty. If Lucy Letby is exonerated, these families don't get relief. They get trauma. New trauma on top of old wounds. The reopening of cases. The re-examination of deaths. The admission that they may have directed years of rage at an innocent woman. And worst of all, the loss of the narrative that made their grief bearable. My baby was murdered by an evil nurse is easier to live with than my baby died and there's no reason why. So when we discuss this case, when we analyze evidence, when we advocate for Lucy Letby's exoneration or continued imprisonment, we must remember, there are no winners here, only different configurations of suffering. Here's what's likely to unfold. February-March 2026. The Thirlwall Inquiry Final Report is published. Expect media coverage of hospital failures. Possible criminal charges against hospital executives. Public outcry. But probably minimal impact on Lucy Letby's conviction immediately. Spring-Summer 2026. The CCRC continues its investigation. They interview the 14 expert witnesses. They commission their own statistical analysis. They review hospital records. Slow, bureaucratic, thorough. Lucy Letby remains in HMP Bronzefield. Her parents visit monthly. She writes letters. She hopes. Late 2026, early 2027. The CCRC completes its preliminary assessment. 3 possible outcomes. They decline to refer the case. Lucy Letby's conviction stands. She serves the rest of her life in prison. The case is closed. B. They request additional investigation. The timeline extends another 12 to 18 months. Lucy Letby continues waiting. C. They find a real possibility the conviction is unsafe. They refer the case to the Court of Appeal. If referred to Court of Appeal, 2027 to 2028, the Court of Appeal can dismiss the appeal, conviction stands. Allow the appeal and quash the conviction, Lucy Letby is released. Order a retrial, Lucy Letby is retried before a new jury with new evidence. If retrial ordered, the prosecution must decide. Proceed with retrial using original evidence, likely to fail given expert reversals. Abandon the case, Lucy Letby walks free. If conviction quashed, Lucy Letby is released after approximately 5 to 6 years in prison for crimes she may not have committed. She's 38 years old. Her career is destroyed. Her reputation is destroyed. She receives compensation but never gets those years back. The families of the 13 babies experience new trauma. The British justice system faces a reckoning. The most likely timeline? The CCRC refers the case in late 2027. The Court of Appeal hears it in 2028. A decision comes in 2028 to 2029. Lucy Letby either walks free or dies in prison. We'll know which in about 3 years. We titled this act The Sterile Void. Because that's what's left when certainty dies. In June 2015, 13 babies experienced medical crises. 7 died. That's the only absolute fact. Everything else is interpretation. The prosecution said, Lucy Letby murdered them. 14 experts now say, the evidence doesn't support that. The jury said, guilty. The science says, maybe not. And in the middle of this void sits a woman, Lucy Letby, who maintains she's innocent, who may be innocent, who may be guilty, who may be both innocent of some charges and guilty of others, who we may never truly know. This documentary can't tell you what to believe. It can only show you what we know, what we don't know, and the vast, sterile void between them. The void where certainty used to live, where, beyond reasonable doubt, has become beyond reasonable comprehension. Where a post-it note that says both, "I did this," and "I haven't done anything wrong," somehow summarizes an entire case. Contradictory. Irresolvable. So here's the discussion question. The one this documentary leaves you with. The one that matters more than guilt or innocence. What do we owe each other when the truth is unknowable? Do we owe Lucy Letby the presumption of innocence now that the science has been challenged? Do we owe the families the certainty of their grief narrative even if it might be wrong? Do we owe the dead babies a continued search for truth even if truth brings more pain? Do we owe ourselves the comfort of certainty even when the evidence demands doubt? There's no right answer. But the question matters. Because cases like this will happen again. Medical evidence will be challenged. Statistical analyses will be debunked. Convictions will be questioned. And we'll have to decide. Do we defend the verdict because it's final? Or do we pursue justice even when justice is complicated? Let's end where we began. With Lucy Letby. In her cell. Wearing institutional clothing instead of the blue NHS lanyard. Her parents visited last week. They told her about the CCRC submission. About Dr. Shoo Lee's reversal. About the 14 experts. About hope. She wrote a letter afterward. To her solicitor. It was leaked to the press. 3 paragraphs. We'll end with the final one. I don't know if I'll ever leave this place. I don't know if anyone will ever believe me. But I know I didn't hurt those babies. I tried to save them. That's what nurses do. That's what I did. And whether the science proves it or not, whether the courts believe it or not, I know the truth. I just hope someday everyone else does too. The Lucy Letby case. Britain's most controversial conviction. A story of dead babies and grieving parents. Medical science and statistical manipulation. Hospital failures and institutional cover-ups. Certainty and doubt. Guilt and innocence. Justice and injustice. We may never know the full truth. The science is contested. The evidence is contradictory. The conviction is under review. And Lucy Letby remains in prison. The only certainty is uncertainty. The only verdict is unresolved. The only ending is to be continued.